Welcome to the Mom Needs a Moment podcast. We're your hosts, Chrissy
and Cindy,
co-founders of Her Health Collective.
We are two moms obsessed with revolutionizing the way moms take care of themselves. We are so glad you're here. Let's dive in.
We are here today with so many of our amazing expert team. Her Health Collective hosts 4 roundtables each year, and somehow we are already here at our 3rd roundtable of 2023. Our roundtables are done in an effort to bring together our experts and dive deep into topics that matter to moms the most. We've found that these roundtables are typically our most well-received episodes. Each of the experts represented in our roundtables have different professional backgrounds and areas of specialty. When we bring these experts together and discuss women's health issues, you, the listener, can expect to get different perspectives based on their area of focus, as well as their own personal experiences. This is also a time in our grand vision for the experts to collaborate with one another, experts and professionals from other industries, in order to create a more holistic model of care for women, which is a core value of Her Health Collective. Our goal is to expand not only the experts referral network, but to emphasize the importance of collaborative healthcare. In our roundtable today, we are discussing the topic of fertility. We are striving to give everything you need to know about fertility from different professional perspectives. We're also hoping that we perhaps receive some perspectives from personal experience as well, particularly with today's topic. Today, we are honored to be joined by several of our 2023 Her Expert panelists. We're going to take a few moments to let each of our experts introduce themselves and just share a bit about themselves, their area of expertise, so that our listeners can hear each expert's voice and have a better idea of who's speaking during the upcoming conversation. So we'll go ahead and get started. Emily, will you take it away for us?
Hi, everyone. I am Emily Chaffee. I am the co-owner and founder of Carolina Birth and Wellness. I am a birth doula, fertility doula, and massage therapist. And I am holding my 6-month-old who was born via IVF in February. So I'm able to kind of talk from all about fertility from a fertility doula and fertility massage therapist standpoint, and as well as my personal experience with IVF.
That is so exciting. I'm really glad you're here. It'll add such a wonderful element to the conversation. And hi, Ella. I'm glad that you're able to join us as well.
Yeah, she says hi.
Hi, I'm Christy Maloney. I'm a registered dietitian and owner of Enhanced Nutrition Associates in Charlotte. My primary specialty is working with women with eating disorders, disordered eating, and body image concerns. The things that, I kind of want to add to the conversation is how we can support hormone health nutritionally and just kind of from a holistic perspective. I think that oftentimes gets left out of fertility conversations.
Hello, good morning. My name is Kirsten Spurrier, and I'm the owner of the Perinatal Pelvis in Hillsborough, North Carolina. I provide pelvic floor therapy. So I'm just excited for this conversation of how fertility and pelvic floor therapy intertwine.
I'm Dr. Hillary Manzik. I am a licensed clinical psychologist, and I specialize in parenting and perinatal mental health. And so perinatal mental health comprises everything from postpartum depression, anxiety, depression, anxiety to pregnancy loss and fertility challenges. And so I've worked with many clients and supported them along their fertility journey. And so I bring the mental health perspective.
Hi, I'm Catherine Andrew. I'm a registered dietitian in Raleigh, and I focus on hormone and digestive health, mostly for women, but some men too. So I certainly deal with a lot of fertility conversations and help women maximize their nourishment and nutrients that they're getting from food and lifestyle.
I'm going to move into our first question to all of you, and we're going to get into some of the statistics of fertility. And this is according to the CDC in the United States. Among married women aged 15 to 49 years with no prior births, about 1 in 5, which equals about 19%, are unable to get pregnant after 1 year of trying, which then is termed infertility. According to the CCRM, one of the industry's leading pioneers in fertility science, infertility rates are rising. There used to be a worldwide average of 5 children per woman in 1950, but in 2020, that average has fallen to 2 children, according to the United Nations. In the United States, about 11% of women and 9% of men of childbearing age have infertility. What are the contributing factors of infertility, and how much is really within a couple's control when it comes to the fertility?
I see a lot of clients who are first thinking about their own fertility, just like as a kind of, I'm planning, we have a lot of type A clients who are planners and want to make the most of it, just as the same as they would be making their birth plan, they're making kind of a fertility plan. So we see those clients who come in. And then we also see people who are struggling in the sense that they are trying to figure out, like, why isn't it working? Because this isn't a conversation that a lot of people have. Like, in our teens, like, you're like, okay, the first time you have sex, you're going to get pregnant. And so therefore avoid it. And you see it in movies, you see it in things. And then when it doesn't work, you're like, well, where do I even start? And so I think like a big part of fertility and learning about fertility is like finding the right words for things. So when are you actually ovulating? When are you actually having these fertile signs? You can't have sex every day of the month and get pregnant. So how do you kind of even learn what to do? So it's a little bit of lack of education. And then I think also just people are waiting a little bit longer. Careers matter a little bit more. And so age doesn't necessarily impact, doesn't make you infertile, but it doesn't help either. So that's kind of where we see our clients who are struggling with fertility.
I remember when I was pregnant at 35, it's almost like that's the magic number. When you turn 35, all of your eggs shrivel up and you're not. Yeah. So very good points. Thanks, Emily.
I just want to say a quick note on thyroid conditions. This is something that I personally experienced, which is why I know so much about it. I wish I didn't. It's certainly not part of my psychology training, but then in going through what I went through with my Hashimoto's diagnosis, I have been able to support some of my clients in getting proper thyroid care. And what I mean by that is that, unfortunately, a lot of times the testing that we do for thyroid hormones for women is very limited. We're not doing all the tests that we need to do. And we're also not doing, we're looking at a range that is way too wide, and people don't do well unless they're in a certain part of the range. I can certainly say more about that or share some resources for people who might want to make sure that they really rule out a thyroid condition. But what we know from the research on how thyroid affects fertility is that some women will never get pregnant while their thyroid's not optimal. Some will get pregnant and repeatedly miscarry. That was me. That's how I found my thyroid disorder. And I would not, and I swear this, I would not have my second and third babies if I hadn't advocated for myself and figured out how to optimize my thyroid, because the medical system failed me over and over. And had I listened to them, I wouldn't have my second two kids. But it's because my thyroid condition was triggered by my first pregnancy. But anyway, and then there are other women who they will get pregnant and they'll be able to somehow carry their pregnancy, but sometimes that will affect things in the pregnancy, right? So there's sort of three categories, but we know that suboptimal thyroid levels have a big impact on fertility. And so that is one thing that I would say, and that I've helped my clients with. I've just sort of supported getting them to the right providers and making sure that they are getting the right testing done to make sure, because many of them had been told, well, your thyroid's fine. And actually it was a big piece of the puzzle.
I had a similar experience where, we experienced infertility with my first and only daughter. My thyroid panels were within normal range, right? But the doctor's like, oh, let's try Synthroid. That was it. Once that happened, it was like, oh, like you were in normal range. You just needed to be a little bit lower. It was that advocating and saying like, hey, something's not quite right, that really kind of led us to be able to, or led me to be able to get the proper care I needed.
I would say for my patients, I see most of them when they've already had fertility issues. So they've already had something that's happened to them, that they're also experiencing the thyroid issues or endometriosis, which is 1 in every 3 women that have infertility issues also get a diagnosis of endo, but it's not really shows up until you start trying to conceive. And so then having the resources for people of who to go to in the area to get the proper care, that their uterus and everything can expand properly instead of having these reoccurrent miscarriages. And then I would just say the stress of that process, right? So even if it works for you this first time, the stress of fertility on your body, and then the stress of like, where is that stress being held? And that stress is really held in that pelvic bowl and that pelvic center. And so that can lead to more issues during your pregnancy too, and just how it all kind of compounds together when you are going through a really stressful thing of how to give these women a way to cope with the stress that may be different than what they've had to do in the past.
It's interesting that Dr. Hillary had mentioned advocating for yourself. And it leads me into a follow-up question that I wanted to ask. When a couple is in the position where they may be experiencing struggles getting pregnant, how do they know that what they're dealing with is actually infertility? How do they know when to ask these questions, advocate for themselves? Is it endometriosis? Is it thyroid?
It reminds me a lot of menopause, right? In that we have this terrible diagnosis system where they are not considered infertile until they have been trying for a year, when a lot of times it's like even before that year that they needed to be getting assistance and help. So wherever you are in your life, basically, if you are thinking about getting pregnant, I would go ahead and get the people on your team that you need, especially someone like Hillary or a therapist. As someone pointed out, I think the stress, even going into that, is so helpful to have someone on your side to talk through and minimize that stress. I know I'm a nutritionist, but I will tell you time and time again that mental health is far more important than what's coming into your body through my mouth. And so really supporting people that way, but similarly with endometriosis or thyroid or all these things, getting a team of people that listen to you, that you have practitioners and providers around that can help you start to think about when we're ready to start trying to get pregnant. What does that look like when I'm coming off birth control or coming off an IUD, understanding that my B vitamins are likely to be depleted and my vitamin D might be low, and how do I support those things? So really, like, when would be like yesterday, and not to give people anxiety over I'm behind either, but anytime is a good time to start thinking about supporting your health if you ever want to try to have babies, is what I would say to that question.
I completely agree. And, the best time to plant a tree is however many years ago, but also the second best time is now, right? If I could go back, knowing what I know now, before I had even tried to get pregnant with my first child, I would have found a therapist, because the transition to parenthood is huge, even if everything goes well. And what we know is that it doesn't go well for most people. We just don't talk about it. Everybody has a story. Everybody has a fertility challenge or miscarriage or postpartum or pregnancy anxiety or depression. Like, there is something, and we don't talk about it. And so I would say getting a therapist to just have that support. And because of my Hashimoto's diagnosis, I found the wonderful world of functional medicine and functional nutrition. And my whole life has changed as a result. I was always a healthy eater. I was always, I've always been into movement and whatnot. But the whole concept of preventative medicine, of getting your body healthy, not just like focusing on disease, right? Like when we go in with a symptom and we're given a medication here, try this. Can we focus on wellness, right? From a mental health perspective and a physical health perspective, can we go ahead wherever you are in your life and start optimizing, right? And really have that support network around you. And stress is such a big part of it. Just building that team around yourself now, you're never going to regret doing that.
I think what's so really hard about that is once you're kind of in that mode of trying to like, okay, I want to start thinking about my fertility. It's like Hillary said, reaching out to a therapist is great, but like once you reach out to your OB, they may or may not know about fertility testing. If you reach out to an IVF clinic, they may or may not be accepting patients if you haven't, hit that magic number of trying for a year. And so that's where it can really get hard, because you're like, I'm asking for help, but who is actually like responding to me? And who is actually going to hear that something doesn't feel right? For myself, I got pregnant like laughably easy with my first. And so we just assumed the second would be the same. And then 5.5 years later, she came along, then I got pregnant 5.5 years later. But I was telling my doctors, I got pregnant with my first, something is different. And they're like, oh, it's just unexplained infertility. It's no big deal. Just do this generic protocol and we'll figure it out. And I was like, no, I got pregnant. I can be pregnant. I'm just not getting pregnant. So like, what are we doing about that? we'll just do 2 IUIs and then move to IVF and it'll be fine. Then you'll happen. And so I was able to work with a provider who heard me and listened to me and validated what you're feeling is valid. And so how can we fix that? To speak to Kristen, I was diagnosed with endometriosis, like 1 in 3 women, but I didn't present with endometriosis. And my doctor kind of validated, oh no, you have it. Like you have the symptoms. Don't diminish your symptoms because you've been struggling. It was just really empowering to hear like somebody in my corner after so long of being told it's unexplained, it's fine.
To our Patreon supporters, thank you. We appreciate you so much. Our goal has always been for moms to know they're not alone in the tough and challenging phases of motherhood. We know Mama Needs a Moment provides this to our listeners.
We are thrilled with the growth of the podcast over the past 2 years. Last year, Spotify shared that Mama Needs a Moment was in the top 30% most followed podcasts, was heard in 9 countries, and had more content than 97% of other creators in the family category.
We have recently launched a Patreon account for Mama Needs a Moment. This is a great way for you to provide additional support to Her Health Collective.
We've set up 3 options for Patreon supporters, each with its very own perks, such as special events, discounts, and bonus content from each and every podcast guest that is available only to our Patreon supporters.
Will you become a Patreon supporter? It would mean the world to us.
Curious, Emily, how you had the endometriosis diagnosis prior to your first or after the first?
After I was diagnosed with it after, but I should have been more aware of it. But my periods were always really easy. It was just a hormonal issue. And I guess I was younger, and thinner and, less stressed because I didn't have kids and I didn't own my own business. So I didn't have as much stress in my job.
Is that the responsibility of your gynecologist or OB to find that? How can we coach our listeners to recognize that there might be something wrong? Because I'm sure
I wish that was an easy answer, right? Like, yeah. I think where I was able to find it is the provider who I was working with, who has since left the area. She was really well educated and she called it subfertility, not even infertility, but she was like, we're going to find it. And she was able to see after daily blood draws and daily ultrasounds that my hormone levels weren't responding in a way that she would have liked. And then she saw some stuff on the ultrasound. So she was just a classically trained OB, but she was also trained in NAPRO technology, which is fertility education and really looking at the body's fertile signs to see how your body is responding and then adjusting treatment from there rather than getting that diagnosis of unexplained infertility and then treating unexplained infertility.
Yeah. So technically to get a full endometriosis diagnosis, you actually have to have surgery, but there are a lot of very particular lab values that can be linked to showing signs of it. What you had of blood draws and those types of things on certain days of your cycle to really be like, oh, this might be a diagnosis that is affecting your fertility. There are different things. It's just like what Emily had of finding the providers that are going to listen to you and really advocate for you and not brush you off as you're crazy or you don't know your body.
To that point and to Emily's point, the biggest thing is really trusting yourself. Like, when something is not right with your body. I remember after my miscarriage, I was told I had been very, very, very I couldn't get up tired during that pregnancy. And they were like, this is just a second pregnancy. You have a toddler. And I knew that wasn't right. And then now I've gone on to have 2 other pregnancies and know that wasn't normal, but they told me it was normal. I knew that it wasn't. And I had to push and push. And I literally went through 5 different doctors until I found someone who would listen to me. But that's what we have to do. And one of the things I work with my clients on in therapy is really trusting themselves. Because many of us were raised, we're upset about something and our parents are saying, it's no big deal, calm down, toughen up, you're fine. And so we've learned to not trust our feelings, and we really have to lean into our body has wisdom, and we know when something is off, and just really tapping into that and then following the steps that we need to find a provider who will listen. And then the other thing, Emily, that you said that I just thought was really important is the language that we use, right? There's so much language in the perinatal world that is blaming women, right? And infertility puts it as if it is somebody's fault, right? And it's actually, that's not helpful language. And so I try, and a lot of us in the mental health world try to say things like fertility challenges, like it's just a challenge on your fertility journey, right? Like it's not a problem with you. It is, it's about getting the right support and the right treatment.
If anybody's talked to me before, they know I struggle with PCOS, which is also one of the leading causes of infertility. You know, when you go to the doctor and they tell you, yeah, you have PCOS, the standard response is, here's your birth control pill, here's your metformin, come back when you want to get pregnant. And I think that that already sets you up to be kind of behind, you know, where you want to be, because there are so many things in terms of nutrition, lifestyle, movement, stress management that can help manage PCOS to make fertility easier when that is the presenting problem, or the presenting issue.
It's actually a great segue into something I just want to pick apart a little bit more. And Christy, that was a great thing that you said, where you go in and doctors will say, well, here you go. And they automatically will prescribe you a prescription, or they go right for the most invasive procedures rather than taking more of a conservative approach to test blood levels, hormone levels, etc. So we talked about mental health and stress, and we talked about hormones. Is there anything else that someone can do when they're starting their fertility journey where it's not as invasive? So I know Emily does fertility massage. I know that Kirsten works with energy. I know nutritionally what things we can do. I just was hoping we could add more for our listeners in this area.
I think our diet culture really affects women's health and really preparing your body for fertility. The idea of stressing our body so much that your adrenal supply is so low when trying to then go and be fertile is just not how women's bodies are supposed to be running all the time. Learning that cycle of hormones with the right exercises for you, and it shouldn't be that you're always doing a 10 out of 10 max cardio workout and then thinking that your body is not, even though for a lot of people that is, they say there's stress relief, that is stressing your body. It's really balancing what exercise looks like and what exercise should look like for women in their fertile ages versus what our diet culture is telling us what we should be doing is huge. And I think we just really have to get back to educating women on what is healthy for their bodies and what food is healthy for their bodies and how it should cycle with their monthly cycles and what you should be doing for that.
I'll add.
I think we had similar thoughts.
Yeah, lots of yeses, obviously, but I would expand that even though into this idea of health optimization being the goal for everyone. That like we're always trying to, in our culture these days, whether it be, you know, a Pinterest-worthy meal or I'm cold plunging, right? There's always something more we can be doing, to the point, even as mothers, how many activities can I get my kids into, right? So it's this more and more culture that we have that absolutely leads into what you're talking about with, I just need to be doing more. And I'm sure Hillary could speak to like, then the mental health struggles of like, we're never enough. And so I see a lot of my fertility women who are backfiring, right? Like they're almost like working against themselves because they're trying so hard to get everything perfect with their nutrients. And I mean, I even like am wary to get into like, what nutrients do we need? Because I don't want someone obsessing over like every food that they should be eating and what exactly they should be doing to be helping, you know, perfect their nutrition necessarily or their health, when to your point, we all need to work on breathing and going outside more and taking slow walks, being present with my family that I do have. And like, what does that look like, instead of putting fertility in another bucket of one more thing that I need to try to achieve and control and manage. And that makes it even worse for ourselves.
Yes, 100%. And I will tell you, the smartest decision I made personally, and then I have helped my clients build this in as well, is to ditch the hardcore cardio workouts and just start walking. And I have a goal. Now I walk 60 minutes a day, and it's built in because I walk my kids to school. But, you know, the 60 minutes was not a thing of perfection, but more that was enough time for me to really feel the effects of being outside. And just, I took away I used to be a fast walker, right? Like get everywhere really, really fast as you can. And I kind of took that pressure off, and I just started walking at a pace that felt comfortable. I started using that time to do a gratitude practice, mantras. I mean, what a game changer. It's the one thing that I can't let slide because it is so good for my mental health. And so I think, to your point, like we are always go, 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 more CrossFit and, beach body workouts and cold plunging, but also infrared saunas. And those are all great things to do. But when we start doing it in this, I have to, or I'm not going to be well, we can get into this perfectionistic wellness culture that actually just, like you said, it backfires. So if you can just do one thing, can you get outside for a walk every day? 5 minutes, 10 minutes, like you don't have to walk for an hour. So that's something I've helped my clients really start to do. And then the other thing I can't say enough good things about is a gratitude practice. There's so much research around gratitude. And, as a therapist, I feel I need to say this is not about pushing down your negative emotions. Like we need to feel those, we need to process those. And we also can lean into gratitude. And it's not about gratitude for things we should feel grateful for, but can you actually connect with a feeling of gratitude in your body? And it could be for anything. The fact that you have a candle that you like the scent of and it makes you happy, right? It can be anything. But the cool part about gratitude is that when we start to really feel that feeling, our brain will come up with more and more things to really be grateful for. And that can be such a powerful practice. And so can you combine that with your walk? Like done and done.
One thing I also really love for people to do when they're starting to kind of enter this fertility journey is learn about their cycle, learn about how many days is their actual period, learn about, do they have cervical mucus, and not necessarily try to do it perfect. You don't need to be charting all the things and making this whole big deal and getting your basal body temperature as soon as you wake up. Just learn about your body. What is your body currently telling you? And I also think so many women kind of normalize cramps as part of a period as a normal thing. And not saying that, they're not really, but if you kind of acknowledge when those cramps are happening, then you come to a fertility educator like myself or your OB and, say all these things. A lot of people can kind of point you in different directions, oh, maybe you need to see a pelvic floor therapist. Oh, maybe, maybe you need this, maybe you need that. And just kind of learning who you are and what your body is telling you is such a powerful way to be at the front of the fertility journey rather than letting a medical provider lead you down okay, this is the standard of care. You do A, B, C, and then you will be pregnant.
Honestly, pelvic floor therapy, having that mind-body connection piece that you've actually even figured out where your pelvic floor is and how to relax it, how to contract it before pregnancy and postpartum is even a thing. A lot of people have had past trauma in their pelvic space, and that can really affect how they're connecting with their body. Working through those things before trying to get pregnant has shown to be beneficial to a lot of people, and have a baseline of I know my body. I know when this is how it's supposed to feel, and I know when this is not supposed to feel this way. Then when it changes, you actually have a baseline of what is normal for you.
Thank you, everyone, for sharing and diving into such a deeply personal topic for so many of you and for so many of our listeners too. We really appreciate all of the information you shared and for sharing your own personal stories. I think it's really important that we share those stories. We hope you took as much away from today's conversation as we did. We're excited to bring you part 2 of this discussion next week, where we will dive into issues with male infertility, explore treatment options, look at the connection between infertility and mental health, and offer ways to show up for and offer support to loved ones dealing with infertility challenges.
High five, friend! We've enjoyed hanging out with you. Follow us so you're the first to know when we drop a new episode.
If you've enjoyed your time with us, let us know by leaving a review. We always love hearing from you. Until next time, stay true to you.